The conversation about men's health often avoids one vital subject, the prostate. Yet, ignoring it can lead to devastating consequences. For men over 50, the prostate becomes a silent gatekeeper of well-being, capable of sending subtle warnings long before severe illness sets in. The challenge is recognizing these early signs before they become impossible to ignore. In this video, viewers will uncover the 10 signals every man should take seriously, signals that could mean the difference between timely action and late regret. I'm Dr. Isabel Lopez, a urologist with over 25 years of experience. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. Her voice carries both authority and reassurance, instantly setting the stage for a balanced mix of medical insight and practical guidance. She doesn't speak in technical riddles. Instead, she translates complex anatomy into language anyone can grasp. That personal connection is essential, because this discussion is not about abstract science, it's about real lives. Prostate health is more than just a medical checklist. It's an investment in one's quality of life. Early detection of problems can not only prevent complications but, in many cases, save lives. While prostate cancer often steals the headlines, other issues like benign prostatic hyperplasia, BPH, and prostatitis can also disrupt a man's daily routine. Recognizing their early manifestations is a skill that can be learned, and this video aims to equip every viewer with that skill. Men often dismiss mild urinary changes or occasional discomfort as just part of aging. That mindset can be dangerous. The truth is, many prostate problems develop slowly and quietly, offering a generous window for early intervention, if only the signals are spotted in time. Through relatable examples and clear explanations, this journey will reveal those signs and show how to respond wisely. Each symptom to be discussed has its own logic, its own way of signaling that something isn't right. Sometimes, the warnings are physical and unmistakable. Other times, they hide in subtle changes, alterations in routine that might be brushed off until they worsen. Learning to distinguish harmless fluctuations from meaningful red flags is the cornerstone of protecting prostate health. The countdown to the 10 early signs begins now. But before diving into the list, it's important to understand exactly what the prostate is, why it matters, and how aging transforms its behavior. Follow the channel, because this knowledge could very well protect you or someone you care about. The prostate is a walnut-sized gland located just below the bladder, wrapping around the urethra like a protective collar. Its primary role is to produce seminal fluid, a vital component that nourishes and transports sperm. While it may seem small and unassuming, its function is essential to male reproductive health. Understanding its anatomy helps demystify the reasons behind the symptoms many men eventually face. As men age, the prostate doesn't stay the same size. In fact, it often grows, a natural process called benign prostatic hyperplasia, or BPH for short. While BPH isn't cancer, it can cause frustrating and sometimes alarming urinary symptoms. Aging also increases the risk of inflammation, known as prostatitis, and the development of prostate cancer, one of the most common cancers in men worldwide. Knowing the distinctions between these conditions is key to seeking the right care. Prostatitis, for example, can appear suddenly, often accompanied by pain, fever, and urinary difficulty. It may result from a bacterial infection or other causes, but it typically demands prompt medical attention. BPH, on the other hand, progresses slowly and is often linked to trouble starting urination or a weak stream. Prostate cancer is more insidious, often silent in its early stages, which is why screenings and awareness are so important. What makes prostate health so complex is the overlap of symptoms among these different conditions. A man with BPH might experience similar issues to someone with early-stage cancer or chronic prostatitis. Without proper evaluation, it's easy to make wrong assumptions and delay essential treatment. That's why understanding the prostate's function and vulnerabilities is more than academic. It's a survival skill. The gland's close relationship to the urinary system means that even slight swelling or changes in texture can disrupt normal flow. Imagine a garden hose with a bend or partial blockage. Water still flows, but it's slower and weaker. This analogy helps explain why urinary symptoms are often the first visible sign of trouble, even before pain or other discomforts appear. With this foundation in place, the focus can now shift to the first of the 10 early warning signs. It's a symptom so common that many men ignore it, yet it can reveal much about what's happening inside the body. Frequent urination, especially at night, is where our list begins. Frequent urination, particularly at night, is one of the earliest and most noticeable signs of prostate trouble. The medical time for waking up multiple times to urinate is nocturia, and while it can have several causes, an enlarged or irritated prostate is among the most common. When the gland presses against the urethra, the bladder works harder and sends signals to empty more often, even when it's not full. For many men, nocturia starts subtly, one extra trip to the bathroom per night. Over time, it may become 2, 3, or more interruptions, breaking the body's natural sleep cycles. This not only disrupts rest but also impacts energy, mood, and overall health. Chronic sleep loss can trigger a cascade of issues, from impaired concentration to weakened immune function, making this more than just an inconvenience. It's important to recognize that nocturia doesn't happen in isolation. It often pairs with other urinary changes, such as urgency or a weaker stream. In some cases, it can be linked to diabetes, heart problems, or excessive evening fluid intake. That's why men should never assume it's just age. A thorough evaluation is essential to identify the true cause. From a diagnostic perspective, tracking frequency matters. Keeping a simple diary of bathroom visits, both day and night, can provide a doctor with valuable insight. This record helps determine whether the problem stems from the prostate, the bladder, or another underlying condition. Small patterns, when documented, often reveal the bigger picture. Ignoring nocturia can lead to a gradual worsening of symptoms and a reduced quality of life. For men with prostate enlargement, unchecked pressure on the urinary tract can eventually cause bladder damage or infections. The body is persistent in signaling distress, and nighttime bathroom trips are often one of the clearest calls for attention. The next sign builds on this theme of disrupted urinary function. Instead of how often you go, it's about how you go. When the flow itself begins to change, it may be the prostate's way of demanding immediate attention. One of the more frustrating changes men experience with prostate problems is a weakening of the urine stream or difficulty getting it started. The prostate's position around the urethra means that even slight swelling can create a partial blockage. This narrow passage forces the bladder to work harder, and over time, that extra effort becomes more noticeable during each trip to the bathroom. In the early stages, men may notice a brief hesitation before urine starts to flow. This delay, sometimes lasting just a few seconds, can gradually extend as the prostate enlarges or inflammation increases. When combined with a weak stream, it's a clear indicator that the urinary tract is under pressure that should never be ignored. These changes aren't just inconvenient, they can also set the stage for more serious issues like urinary retention or bladder infections. Retention occurs when the bladder can't fully empty, leaving stagnant urine that becomes a breeding ground for bacteria. Over time, this can also weaken bladder muscles, making recovery more difficult. Join the members club and leave a super like. By doing so, you're not only supporting valuable content but also helping raise awareness for a health issue that affects millions of men worldwide. These discussions can quite literally change lives, and your engagement ensures they reach those who need them most. Monitoring the force and consistency of urine flow is an important self-check. If the stream begins to vary, strong one day, weak the next, it may indicate intermittent obstruction or shifting inflammation. This variability can be an early red flag, especially if accompanied by other symptoms such as frequent urination or discomfort. Our next sign takes us deeper into the realm of discomfort. When urination itself becomes painful or produces a burning sensation, it's no longer just a matter of inconvenience. It's a sign that the body may be fighting an infection or facing inflammation that demands prompt attention. Pain or burning during urination, medically known as dysuria, is a symptom that demands immediate consideration. While it can result from something as simple as mild dehydration or irritation, in men over 50 it often points toward infection, inflammation, or obstruction within the urinary tract. The prostate, when inflamed or infected, can send sharp signals of distress through the act of urination itself. Prostatitis is a common culprit behind this symptom. In its bacterial form, it can develop suddenly and bring along fever, pelvic discomfort, and a sense of heaviness in the lower abdomen. Chronic prostatitis, on the other hand, may cause milder but persistent pain, often paired with urinary changes that don't resolve on their own. Ignoring these sensations only allows the underlying condition to progress. Another possible source of burning is urethral irritation caused by the narrowing of the passage, either from prostate enlargement or scar tissue. This restriction creates turbulence in urine flow, which can aggravate sensitive tissue. Over time, this can lead to microtas or infections, compounding the discomfort and making each bathroom trip an unpleasant experience. Because urinary burning can also stem from bladder or kidney problems, pinpointing the source requires professional evaluation. Lab tests, imaging, and sometimes even a prostate exam help clarify the diagnosis. Self-medicating or assuming the pain will just go away risks masking the real cause and delaying targeted treatment. From a practical standpoint, paying attention to timing and severity matters. Does the pain occur only at the start or throughout urination? Is it worse in the morning or after certain activities? These details can help narrow down whether the issue originates in the prostate, the bladder, or elsewhere in the urinary system. When pain and urinary symptoms merge, the next step in our journey addresses one of the most alarming signs a man can experience: visible blood in urine or semen. This signal often stops men in their tracks, and for good reason. Few symptoms create as much immediate concern as seeing blood in urine or semen. Even a small amount of discoloration, ranging from a pinkish hue to deep red, can be a signal that something serious is at play. In medical terms, blood in urine is called hematuria, while blood in semen is known as hematospermia. Both deserve urgent evaluation, as they can be linked to infections, trauma, or more severe conditions such as cancer. The prostate sits at a key junction where reproductive and urinary pathways meet, making it a likely source when blood appears. Infections or inflammation can irritate delicate blood vessels, while prostate cancer can cause more persistent bleeding. Sometimes, the cause is benign, such as a ruptured vessel after vigorous activity, but ruling out dangerous conditions is always the priority. Blood in urine can also originate from the bladder or kidneys, which share the urinary tract with the prostate. Determining the source requires diagnostic tests like urinalysis, ultrasound, or cystoscopy. The presence of clots or recurrent bleeding is particularly worrisome, as these may indicate an ongoing, untreated problem. When blood is found in semen, the emotional impact can be just as strong as the physical concern. Many men fear the worst, yet in younger individuals, the cause may be temporary inflammation or infection. For men over 50, however, the possibility of prostate-related disease makes medical investigation essential. While a single episode of blood may not always signal a life-threatening condition, repeated occurrences should never be ignored. This symptom is the body's way of demanding immediate attention, and time is a crucial factor in successful treatment. The earlier the cause is identified, the broader the range of options for recovery. Next, the journey moves to a sign that doesn't always appear in the bathroom mirror. It's about pain that radiates to unexpected places, pelvic or lower back discomfort that can be traced back to the prostate. Pelvic or lower back pain may not be the first symptom most men associate with prostate problems, yet it is surprisingly common. The prostate is surrounded by a complex network of nerves and muscles, and when it becomes inflamed or enlarged, discomfort can radiate beyond the gland itself. Men may feel a dull ache deep in the pelvis, or a persistent soreness that sits low in the back, making it easy to confuse with muscle strain. Unlike muscular pain, which often improves with rest and stretches, prostate-related discomfort tends to linger and may worsen over time. It can be constant or appear intermittently, sometimes intensifying during urination, ejaculation, or after long periods of sitting. This pattern provides important clues that the source may be internal rather than skeletal. Inflammation from prostatitis can cause nearby tissues to swell, placing pressure on nerves that connect to the lower spine and pelvic floor. In some cases, the pain can extend to the hips or upper thighs. Because of this nerve overlap, men sometimes spend months treating what they believe is a back problem, only to later discover the prostate was the true culprit. Cancer can also manifest with pelvic or back pain, especially if it has advanced beyond the prostate gland. While this is less common in early stages, it underscores the importance of not dismissing unexplained discomfort. When paired with urinary symptoms, pelvic pain should raise a strong suspicion for a prostate-related condition. Men are encouraged to keep a simple pain log, rating intensity, duration, and potential triggers. This record not only helps physicians pinpoint the cause, but also creates a timeline that can be critical in detecting changes. Details matter, especially when the discomfort is subtle but persistent. Join the Members Club, drop a super like, follow the channel, and leave a comment. Our final segment will bring all 10 signs together in a quick recap, reinforcing why timely attention to these symptoms can make all the difference for long-term health. Prostate problems rarely appear overnight. They build gradually, sending signals that are easy to miss if you don't know what to watch for. Over the course of this video, we've explored 10 early signs: frequent urination, especially at night, weak urine flow, difficulty starting, pain or burning during urination, blood in urine or semen, pelvic or lower back pain, and the other symptoms discussed along the way. Each one is a piece of the larger puzzle of prostate health. The takeaway is simple: early recognition saves lives. A few minutes spent observing changes in urinary patterns, discomfort levels, or other subtle cues can make the difference between a manageable condition and a late-stage diagnosis. Men over 50, in particular, should treat these signals as urgent invitations to seek professional guidance, not as inconveniences to be ignored. This isn't just a conversation for those already experiencing symptoms. Spreading awareness to friends, brothers, fathers, and colleagues ensures that more men catch problems while they are still treatable. The earlier the intervention, the less invasive and more successful the solutions often are. Maintaining prostate health goes beyond medical checkups. It involves lifestyle choices, balanced nutrition, regular exercise, adequate hydration, and stress management that all play a role in prevention. These daily habits form the foundation for keeping the prostate functioning at its best. For those already facing prostate issues, the message remains hopeful. Modern treatments, from medication to minimally invasive procedures, have advanced tremendously. When paired with early detection, these options can restore quality of life and protect long-term health. So, share this video with the men in your life. A single conversation could help someone recognize a warning sign before it's too late. Awareness is the first step, and action is the bridge to lasting health.